Based on what I've seen and read in the media, and I wholeheartedly agree that this is the equivalent of a blast effect. An IED is basically the vernacular that we use nowadays. Bleeding must stop. If bleeding doesn't stop, the patient will die within minutes. We know from our military's experience in Afghanistan and Iraq that tourniquets save lives when it comes to extremity woundings. So the trained first responder will arrive on the scene. If he or she sees overt bleeding from an extremity, then the best thing they can do is put a tourniquet on that extremity and stop the bleeding immediately. Following that, the patient can be transported to a trauma center and evaluated for the cause of the bleeding and what needs to be done. In terms of traumatic amputations, patients who have had a limb quite literally blown off, those wounds are extremely contaminated by definition. So they're not the amputee that one thinks of traditionally, where the patient's taken to the operating room, a limb is amputated, and the wound is closed. In general, those patients will require serial trips to the operating room because the first thing to do is to take off the severed limb as best as possible, but that'll leave a contaminated field behind, and those patients will need serial debridements before the wound can be definitively closed. So when the surgeon's trying to determine all these things, he or she will look at the amount of soft tissue loss, how much muscle mass is missing, how much skin is missing, the nerve injury involved, can the patient move their extremity, can they feel their extremity, the vascular injury involved, is there blood flow to that extremity, and how much resources have to be expended to reconstruct this whole thing, and will the patient, him or herself, be able to withstand all of these interventions? Or is it better overall for the patient to have that limb amputated and replaced with a prosthesis? A very difficult decision for both the patient and the surgeon.